Hello, lovely friend. I am Dr. Mary Barson.
And I'm Dr. Lucy Burns.
We are doctors
and weight management and metabolic health experts.
And this is the Real Health and Weight Loss Podcast. Hello, lovely friend, and welcome to this episode of the Real Health and Weight Loss Podcast. I am Dr. Mary Barson, and today I am very excited to be joined by special guest, Dr. Paul Froomes. Paul is a Melbourne-based gastroenterologist with more than 30 years experience helping patients with complex digestive disorders. He trained at Melbourne Uni and is a fellow of the Royal Australian College of Physicians, and he has combined his advanced training in endoscopy and esophageal physiology along with his master's degree in liver disease at Melbourne University. He is highly credentialed. Throughout his career, Dr. Froomes has focused on uncovering the root cause of conditions like irritable bowel syndrome, reflux, inflammatory bowel disease, rather than simply managing the symptoms. He has published research, trained other doctors, and developed innovative treatments for the approaches grounded in microbiome science. He's also the co-founder of the Microbiome Clinic, which is a modern medical practice dedicated to translating all of the decades of microbiome research into practical patient-centered care. Today, he is passionate about raising awareness of how important our microbiome is and how useful microbiome-based medicine can be. We are delighted to have him with us. Thank you so much for joining us, Dr. Paul Froomes. I would love it if you could tell our listeners a little bit more about you and what you do and how you can help people particularly improve their gut health.
Right. Well, thank you very much for inviting me on the podcast, Mary. Always love talking about the microbiome in the gut. So as you've already mentioned, I'm a gastroenterologist. I guess, so I got interested in this whole field and developed what I do for people, which is optimize their health through their microbiome, because the microbiome is now considered to be probably one of the single most determinants of not just gut health, gut function, but also it's involved in the way physical disease develops and, of course, mental illness develops. And you can do a lot for someone's overall health by optimizing their microbiome. And that's sort of fundamentally how I've evolved my career in gastroenterology. And so I guess it got triggered by the case of severe Clostridium difficile enterocolitis I saw as a younger consultant as part of the team at a public hospital where this patient was dying on inotropic support. And then one of the registrars rolled up, this is like the day before we were pulling out, we're going to turn him off, and produced a paper saying that fecal transplant cured a patient or cured a number of patients, a case series in the States of people who were in exactly this situation, and produced a signed consent form from the wife and to the meeting where all the consultants were, the gastroenterologists, the infectious disease physicians, the ICU physicians, and we're all sort of looking at each other going, what is this? Well, I suppose, all right, we could do it, but, just be aware you might die on the end of whatever this thing is, this fecal transplant. But so we did it down the nasojejunal tube, and within 24 hours, the bloody diarrhea that was just pouring out of the rectal tube, it just stopped. And then days later, the patient's, weaning off inotropes, kidneys working again. And then eventually they moved out of ICU to HDU and then walked out of the hospital. So that was a bit of a shock to the medical world in that hospital. And I thought, well, what have we just done? And when you look into it, it's really just a massive probiotic infusion, essentially. And I thought, if I can do that, then I need to get involved. So I got pretty interested in the microbiome from then on. I spent decades reading about it, researching it, and then putting it into practice. And you probably know that gastroenterologists are not great with functional gut disorders. And now that we know that there is a clear cause, and that is obviously dysbiosis, then developing ways to treat that has been incredibly rewarding and incredibly helpful. So I just loved going into that field because of how effective it is.
Yes. I love that you said that. And for our listeners, could you explain what you mean by functional gut disorders?
These are the orders, probably the biggest misunderstanding, I think, in gastroenterology is grab bag of disorders called functional gut disorders. Now, most people think functional means nothing's wrong. It's like patients presenting with chronic gut symptoms. Classic ones are functional bloating, functional dyspepsia, irritable bowel, functional or slow transit constipation, functional diarrhea. There's literally probably 40 or 50 of these things now. And it just describes persistent gut symptoms that there's no structural disease that we can find. So they do all their screening tests, standard stool tests, blood work, celiac testing, colonoscopy, gastroscopy, CT scans, gallbladder function studies. And you just go, there's nothing, we can't find anything wrong here. So modern medicine struggles with those disorders and then just puts them in this basket of meaningless diagnosis called functional. And most gastroenterologists would think, and surgeons, functional, there's nothing really wrong, they're just stressed, they're just anxious. What I've found is that, the commonest thing you'll see is IBS, irritable bowel.
Absolutely.
Now, it's not a structural disease, but it's not imaginary either. It's very real. And the physiological studies have shown that there is, in fact, actual disorder of function. So I don't think of functional meaning nothing's wrong, you're just a bit anxious, it's in your head, you're a stress head, go away. I've done your colonoscopy, bye. Well, I think the research has shown that in irritable bowel syndrome, let's take that because most people understand what that is, there is altered motility. We call it visceral hypersensitivity. So the nervous system in the gut is hypersensitive. And so, a bit of bloating or discomfort for someone who doesn't have one of these disorders wouldn't bother them. But in these people, it causes quite extreme discomfort and pain. That's the hypersensitivity component. There's also immune activation, so the immune system's overactive. And there's gut microbial imbalance, which we'll talk about. Fermentation instead of digestion, so there's gas production, distension. And there's dysregulation of the gut-brain axis, which is what exaggerates these symptoms and I guess tends to make people think of them as, it's all in your head.
And I see that a lot, like they're extremely common. And
they are common.
Yes.
And they're only getting more common.
Yes.
The very first case, you'll love this, the very first case of irritable bowel syndrome was written up in a Canadian medical journal. This is, I can't remember how long ago, but mid-1900s. And it was 2 years after they set up the first 3 McDonald's restaurants. And it was a case in that one of the suburbs where it had been built. And it was one of the main things this woman was eating. So hence, that's probably the first case of food-induced dysbiosis, IBS.
I do love that.
You would get that.
I absolutely get that. One of our main pillars in lifestyle medicine is real food, and it is so incredibly important. Can you tell us more about that food-induced dysbiosis? This is fascinating to me.
Well, there's a number of causes of gut. So we think of your gut as essentially 2 components now. One is the structure, and that involves all the intestines, stomach, esophagus, small bowel, large bowel, gallbladder, pancreas. The second component of the gut now is called the microbiome. And the gut microbiome is, for your listeners, refers to literally trillions upon trillions of bacteria that live in the gut. So that's what we're talking about. We're talking about this population of microbes that live in this lovely symbiotic relationship with humans. And they are not just there for looks, they're highly metabolically active. And they're doing basically 90% plus of the work of digestion, which is allowing nutrient absorption, motility function, nervous system balancing, immune system regulation. So the composition of these bugs needs to be what we call probiotic. The problem is that it often gets unbalanced and it turns the opposite to dysbiotic. And that's when the problems occur. Now, this really depends on your food and lifestyle. So a whole food, mainly plant-based diet with good sources of protein and healthy fats, where you are not taking chemicals in, so you're eliminating highly processed foods, you're not taking regular antibiotics, you're actually not destroying your microbiome, but you're feeding it with a really healthy diet or a natural diet or a whole food diet. essentially the Mediterranean diet, you're going to simply nurture and foster the growth of good probiotic bacteria. So that means a healthy functioning gut. The opposite is true. If you start going down the standard American or standard Australian diet, the SAD diet, which is essentially really high in refined sugars, very, very high chemical load, or xenobiotic load is what we call it, which is all the chemicals we put into processed food, and you're not eating enough fiber. So this is, as you can imagine, that's a very unhealthy diet. You're not feeding any probiotic bacteria. They basically die off. And dysbiotic bacteria, which are just sugar fermenters, take over the microbiome. So diet can keep your microbiome robust, healthy, biodiverse, and populated with probiotic bacteria, which means you are going to be super healthy. Or it can be the exact opposite, promote dysbiosis and chronic ill health and dysfunction of the gut.
And is it true to say that what we eat is the main driver of, the health of our microbiome ecosystem?
Yeah, that would be a pretty accurate statement, because these microbes eat, and it's not just us that eats. They consume something like 20 grams of carbohydrates, 10 grams of protein. They're entirely dependent upon what you feed them. And as we said, probiotic bacteria eat prebiotic fibers, and the bad bacteria eat sugar. So yes is the answer.
Yeah. Okay, I imagine this list is probably going to be exhaustively long, but in your expertise, could you give us a rundown of what are some of the major consequences of having, gut dysbiosis?
Okay, that's a long question to answer.
It is, yes.
Let's just
everything would be an answer.
Basically,
yep.
the start is gut. So
yeah.
If you have dysbiosis of the gut, then of course you're going to affect, first of all, digestion. So you won't be able to break down food properly. So you'll have undigested food fermenting away in the gut. So that's going to cause irritation, pain, nutritional depletion. There's excess gas production. So that's going to cause distension, belching, bloating, flatulence, wind, and pain, sometimes pain. Then there is things like toxin production. So dysbiotic bacteria produce probably the commonest one you will have heard of is LPS, endotoxin. But there are aldehydes, acetates, lactic acid, lactate. There's about and gases, hydrogen sulfide, sulfur dioxide, methane, some of which are damage DNA and cells, also tight junctions. So they damage the gut. So you get gut damage as well as on top of that. Then they trigger off pain receptors in the enteric nervous system. So that's when you get the pain in the nervous system, hypersensitivity. Then they send signals up the vagus nerve that are noxious. So the vagus nerve then activates the fight or flight response. So you get stress, anxiety, and then the next step from that is depression. So these are all consequences of a dysbiotic microbiome. Then there are certain bacteria that put you at increased risk of colonic polyps and bowel cancer. So there are other dangers long term of having dysbiosis. But probably for the most people, it's inducing all those symptoms in the gut: pain, bloating, distension, wind, flatulence, diarrhea, constipation, fluctuating on and off, associated with the brain fog, the fatigue, the anxiety, the depression. They're sort of the main things that dysbiosis drives. And we know a lot about the metabolites they're producing that do that cause it, that induce the inflammation and the symptoms and the gas and the pain. But it's a double whammy, because if you have dysbiosis, then you're also missing your probiotics. So you're no longer in a state of probiosis. So you're missing out on all the protein benefits of having a population of probiotic gut bacteria that are doing all the work of digestion, nutrient absorption, nutrient production for absorption, maintaining cellular integrity of your gut lining, maintaining normal gut nervous system function, immune function, so you become immunosuppressed. Yeah, so dysbiosis has two sides to it. It's not just bad bacteria, it's the lack of probiotic bacteria. Now that's just sticking to the gut and a bit of gut brain. But your listeners may not understand there is a gut microbiome link to every organ in the body. So there's a gut-brain axis, we know about that. They've probably heard about that. But gut-liver axis, gut-heart axis, gut-adrenal axis, gut-muscle axis, gut-eye axis, gut, lung. Look, you could talk about every system.
Totally, yes.
But it is linked to everything. So gut dysbiosis is probably one of the main drivers of every single degenerative disease of aging there is, plus a whole lot of other problems that people suffer. And they've even linked it, the microbiome, to pretty much all autoimmune diseases now. So it's a very important area of health that is largely overlooked, in my opinion.
Yes, that is very interesting and extremely important to hear. I would like to focus a little bit more, zero in more about metabolic health, obesity, weight gain, diabetes, hyperinsulinemia, and to get your expertise on the link between gut dysbiosis and these more metabolic conditions, because that is something that our listeners are particularly interested about.
Right. Okay. So, well, people got really interested in this aspect of the microbiome when there was a mother in Rhode Island who developed nasty C. diff colitis, resistant to vancomycin, which is the antibiotic we use to treat it. And so she was offered fecal transplant as the only solution. But back then, you could only use a first-degree relative. The only first-degree relative she had was an obese daughter. So now everyone is saying, oh, no, not a good idea. And that gastroenterologist said, well, what do you mean? There's no link between the microbiome and obesity. People said, well, actually, this was probably 25 years ago. There is animal models. So if you do a fecal transplant from an obese human into a germ-free lean rat, the rat rapidly becomes obese. So we're thinking, okay, that's interesting. Maybe there's something to this. We now know there's an obesogenic microbiome. There's also a diabesogenic microbiome. So essentially what happened was she got her daughter's microbiome. She put on, over the next year, 37 kilos. And 3 years later, she still hadn't lost it, couldn't lose it. So that got everyone thinking in this space. What is this link between the gut bacteria and obesity or weight gain or metabolic health? So what we now know is that your gut microbiome is kind of almost like, it's like a metabolic organ. As I mentioned, these bacteria are very busy. They don't just sit there. They're metabolically very active. And so that influences weight regulation now through a number of mechanisms. So these bacteria usually act through signal molecules on various receptors to influence metabolic health. So first thing they do is dysbiotic gut bacteria will increase what we call energy harvest from food. So you can eat the same meal as, an identical twin. But if one of them's got dysbiosis, they will extract and absorb more calories from the same meal than a lean person. And that's because these microbes are involved in doing that, breaking them down and releasing more calories. They'll alter short-chain fatty acid production and these little things related to metabolic health. And particularly it'll affect insulin signaling. These bacteria can literally promote insulin resistance, which is highly inflammatory and that's sort of the basis of metabolic health being good or bad. They can alter bile metabolism and therefore fat absorption to be increased. They produce altered permeability inflammation. Inflammation's involved in insulin resistance and weight gain. The other thing is they make little signal molecules that bind, so that affect your appetite. So they can make you crave carbohydrates or sugars or overeat. And that's through alterations in, as everyone knows, the GLP-1 receptor and also another receptor, PYY. So they're literally altering and regulating your appetite to increase it, dysbiotic bacteria. So you're just eating more as well as absorbing more calories and starting to become insulin resistant. And then the other problem is you lose your microbial diversity when you've got dysbiosis. Remember, we mentioned you lose all your probiotics. And you're getting endotoxemia, you're getting increased gut permeability, inflammation, insulin resistance, and then bang, you start to get visceral fat accumulation. And so that is a big problem. And butyrate, which is one of those short-chain fatty acids I mentioned before, is very important. It's central to metabolic health. And so if you haven't got the probiotics, you don't make the butyrate. And so if you change it and butyrate, you can correlate increases in butyrate production with weight loss and improve metabolic health. So you need to correct the dysbiosis and you need to bring the probiotics back. But diet's a big part of that too.
Dr. Paul Froomes, I am absolutely loving this conversation. I think that though we'll have to have a little break here and that we will continue on with the rest of this beautiful information next week. I'm going to make this podcast a two-parter. This conversation is so fascinating and so important that I want to keep going into more detail. So we will continue on next week.
The information shared on the Real Health and Weight Loss podcast, including show notes and links, provides general information only. It is not a substitute, nor is it intended to provide individualised medical advice, diagnosis, or treatment, nor can it be construed as such. Please consult your doctor for any medical concerns.